Hello. We will be talking about high alert and hazardous medications in the ambulatory surgery center. It is the policy of the facility to manage high alert and hazardous medications and to minimize the risk associated with these medications. We use as a reference to guide us the Institute for Safe Medication Practices, also known as the ISMP, and we have also developed our own list based on the medications that we have in the facility. So, exactly what are high alert medications? The term high alert is used for such medications as concentrated IV electrolytes, opiates, narcotics, insulin, and anticoagulants. The reason these drugs are singled out, they have a very high risk of causing significant patient harm when they are used in error. Hazardous drugs are defined by the National Institute for Occupational Safety and Health. The bulk of these agents are chemotherapy drugs, but also includes antiviral drugs, hormones, and bioengineered and other miscellaneous drugs. That we do not have to worry about too much in the ambulatory surgery center because for the most part, we do not use these agents. So exactly how do we manage these high alert medications? What are the procedures that we follow? So the first thing that we do is we identify in writing the high alert medications that we have on site and the specific strategies that we use to minimize errors. In order to do this, these medications require independent double checks at the bedside by two appropriate people for high-risk medications and documentation on medical records at the initiation of administration. All physicians, nurses, and others who administer high alert medications will have medication administration training and competencies to make sure that we are adhering to these medication rules and following our policies and procedure. This also applies to anesthesia. Another heading under the high alert medication is what we call LASA, look-alike, sound-alike medications. Again, we follow the same thing. What we do, we want to minimize the potential for error resulting from miscommunication due to the medication names with similar spelling or pronunciation. So we also refer to the ISMP as a reference for the list of high alert medications. And we've also developed our own list based on the medications we have on site. These medications recognizes that medications can look alike, sound alike. Some of them may have the same tops and they could be grabbed inadvertently because they may be next to each other, or the names may look similar, and in an unconscious moment, we could be thinking one thing and pull another. So these medications, we identify them by affixing look-alike, sound-alike stickers to them. So how do we do this? The medication names that look similar or sound similar are identified as a potential source of error in healthcare facility. And so there are a couple of things that we do. We do not store the products that has similar sounding name in the immediate proximity. In other words, we don't store them next to each other. We want to use stickers and safe handling procedures. We want to use Tallman lettering to differentiate the difference in the printed names. And we want to make sure that vials of different medications that look similar are not stored next to each other. So that's how we will be identifying all look-alike, sound-alike medications. Also, high alert medication has a lot of focus from the Joint Commission and the AAAHC and the state. These are the accrediting agencies. And during their survey process, they look to make sure that these medications are identified. And A high alert medication, it's not just a good idea, it directly affects our patients' safety. And that is exactly what we all want to do to keep our patients safe.